I never gave up because I thought we would always find a solution.
Back in 2015, my daughter and I had gone out to take a walk around the neighborhood, and it's something we did every now and then. I had always been active, sports growing up, and we were about to climb a hill and started exerting ourselves. And I felt this excruciating pain across my shoulders, up my neck, both ears, and then my head, and the pain went in exactly that order. So I made an appointment to see my primary care physician, Dr. Harrington. Went in, and he felt like something might be going on with the heart, so he referred me to Dr. Chandra.
That was very scary. We were at a situation where if she wouldn't have came in and wasn't paying attention to her health and listening to her body, she wouldn't be here today.
Dr. Chandra explained to me that even though cholesterol or blockages or heart issues didn't run in my family, the reason that I had the blockage was from basically having uncontrolled diabetes for 12 years.
Lisa was referred by her cardiologist to see me for a weight loss surgery. She had a cardiac history and other medical problems with severe diabetes, and her weight was really not the biggest problem. It was her medical conditions that were really affecting her life.
Being diabetic, and anyone who knows it's a full-time job. It's something you really have to make a priority. I didn't do that. I had a hard time making myself a priority, much less controlling the diabetes.
Obesity is a disease. It's a disease like colon cancer and breast cancer is a disease. So what we're looking at when we look at the obesity epidemic that we have, it's a genetic predisposition that's impacted by our environment behaviors.
We want to be able to retire someday and enjoy our lives together, do traveling, and just sit on a park bench and enjoy the sunset or the sunrise. We could see that wasn't going to happen with the health condition that she was in at the time.
I finally said, I'm done. I can't do this. I don't want to be on insulin for the rest of my life. In August of 2016, I went to one of Dr. Northup's seminars. Stayed around afterwards, asked some questions. Immediately went to the table in the back, made an appointment for a consultation. My husband was there with me. We went in this together as a team.
I was excited to see people there that had been in the same situation she was in, and be able to see them after the surgery and listen to their story. And to me, that was proof that we can get there.
She's a very strong, intelligent person, and I think she was very adamant about having her surgery in the beginning. And we have an expectation here. I think, unlike a lot of programs, that we want them to make behavioral changes and be appropriate for surgery, because we're not worried about your 3-month weight loss or your 6-month weight loss. I'm worried about the 1 year, 2 year, 10-year success rate of these patients, because we can impact how long they live by doing surgery.
I went for pre-op early February of 2017. Having not done exactly what I was supposed to do during this time, I kind of slipped and wasn't taking the insulin again, and thought, oh, well, it's okay. It's the surgery that's going to help me. I need to get the surgery done in order to get well. If I could just have the surgery. So I go in for the pre-op, blood work, x-rays, everything required. Within about a half hour, the hospitalist comes into the room and says, we have a problem. Your blood sugar is 500. We can't do surgery. I was devastated. Even though it was 100% my fault that I couldn't do what I knew was going to help me, I was devastated. I was angry. I was upset with Dr. Northup. I was upset with myself. I was upset with anybody that I could be upset with.
I think anytime a patient hears maybe something they don't want to hear, or hears, that they want a surgery or want a procedure, and someone's saying no, that's not what they expect. And I think a lot of bariatric programs, I review programs at the American College of Surgeons all over the country, and I think a lot of patients don't get told no when they maybe shouldn't have had surgery. And I think that's one thing that our Premier program excels at, is taking care of the patient first and not just trying to get more surgeries done or do another procedure. I think we take each patient individually, make sure that they're appropriate for surgery, make sure they're ready for surgery, and take our time and get them to surgery properly instead of just trying to rush them through the process.
So I let it go for a couple of months. In the fall of 2017, I decided I'll go back and see Dr. Northup. I went in and I remember him saying, "I'm glad you're back. I'm glad you came back."
I'm just here to help. Our program's here to help people. And anything we can do to help people, you might need 2 or 3 starts, to get going, and that's okay.
I told him, I'm on track. The diabetes is becoming under control. I'm doing exactly what I need to be doing. I want to have this surgery because in the end, this surgery is what's going to save my life. So we started back up where we left off. He agreed to do that. He did make me start over and go back through 6 more months. We picked right back up. I saw the dietitian for the next couple of months, and I was put on his schedule for January 10th of 2018.
The day that we went to the hospital for the surgery and they took her back, it was like, this is truly going to happen now.
The surgery was done. There were no complications. His team was amazing from start to finish. I ended up having to stay 2 nights in the hospital, which is normal for Roux-en-Y, gastric bypass. As soon as I was able to get out of the bed and start walking, if you wanted to find me, it was in the halls. That was one of the things they say you have to do. You have to get up immediately and you have to start walking. And I did it. I walked and I walked and I walked and I walked. I walked more than I was probably supposed to, but I did it because I knew this is the beginning of the rest of my life.
This surgery provides a little bit better impact on type 2 diabetes, especially when weight is not her primary problem. Her weight wasn't as impactful as her diabetes and heart disease were. So with gastric bypass, we have a little bit more success getting rid of type 2 diabetes.
I took my last insulin shot the night before surgery. I have not had one since. As of July of this year, 6 months after surgery, my A1C is 5.5, and I am no longer considered diabetic. My goal has been met.
It's huge, yeah. I mean, you think about, how hard we struggle managing type 2 diabetics from a medical standpoint. It's much more difficult to, you can control it, you can maintain it. With weight loss, sometimes you can resolve it, but there's a lot of comparisons, very prominent comparison studies that were done looking at intense medical therapy versus surgical weight loss. If surgical weight loss is 5 to 1 likelihood of getting rid of type 2 diabetes.
I wanted the lady back that I married. I wanted us to go out and do things and enjoy life together. And that was difficult.
I would work, I would come home and nap, I would eat dinner, I would go to bed. And most of the time my family wouldn't see me for 5-10 minutes, and that was it. But it's not that way anymore. We're active, we do things. We took it upon ourselves for the two of us to take our 3 grandchildren from 2 to 8 to the Columbus Zoo by ourselves. I would have never done that. I wouldn't have had the energy to do it. But now we can enjoy more of what life has to offer for our kids and retirement. And that's one of the things my husband would always say. I want to retire someday, and I want you to be there to travel with, and I want you to be there to live the rest of my life with. And so, I guess in the back of my mind, then that was part of also what helped me get to the point of doing what I had to do so that I can be there.
I think that one of the most interesting things about her whole entire story is the fact that we told her no. I could have done surgery and gotten paid. So that would have been the easy thing to do. She'd have been happy not having to be delayed. We'd have done another surgery. But, ethically to me and morally in my soul, I don't think that was the right thing to do.